Hello, my name is Dr. Jackson Drager and I'm here today to talk about chronic pain and what we do here at Midwest Pain Solutions. So let's dig right in. As I said earlier, I'm Dr. Jackson Drager. I work alongside my father, Dr. Kurt Drager, and we run what is Midwest Pain Solutions together. This is my cute family, my wife Alexis, my daughter Dolores, and our new son Raphael. Goals for today include talking more about why you are in pain, why other therapies haven't worked yet, or they only are temporary, and what makes Midwest Pain Solutions different and why those differences matter. Here's a video introducing some of our patients before they've had Midwest Pain Solutions treatments.
When I was in pain, my life was very, very limited and getting smaller. A lot less things I could do, and a lot of simply things were painful.
My pain probably started about 10, 12 years ago in my lower back. Pouring concrete is hard on your body just because it's a lot of physical up and down and movement and twisting and turning.
I did something at home with my back, and I had the pain start in my butt, and it went down my leg, and it intensified in the leg. It was to the point where I could hardly walk, and standing was next to impossible. Sitting was painful. Everything just seemed to hurt the leg. I couldn't walk any distance at all.
I've had chronic pain for about 15 years, off and on. It would get worse, then it would get better. I went to physical therapy, did exercising. But the last year and a half, it's got progressively worse to the point the last month before I came, I couldn't even stand up without being in pain, and I could not twist my body. It was very painful. And walking up steps, I literally had to pull myself up the steps in order to get up there. It was just so painful.
I've had chronic lower back issues for a long, long time. My husband and I own multiple restaurants, so we work pretty much 6 or 7 days a week for years. I thought when we retired 2 years ago that my body would finally have time to heal, but the damage was already done at that point.
The main thing I came in for was neck tightness, neck pain. I couldn't even sit as a passenger as a car anymore. I was wearing a cervical collar for support, and it was not going away. And I was trying topical solutions and things like that, and it just was not going away.
The pain I was experiencing was the most I've ever had. My pain was severe. I could barely make it through the day. I'm a farmer's wife, and we have kids that work for us, so I'm making meals, helping with kids. I basically had to lay down because the pain, the standing and the sitting were the worst.
Does this sound familiar? Sounds like it's hitting a little closer to home. The typical people that we will help, they present with all different types of problems. As you can see on the slide, we help people with musculoskeletal pain, osteoarthritis, back and neck pain, disc degeneration, disc herniations, sciatica, stenosis, all different types of joints, shoulders, knees, hips, elbows, anything in the back, as well as ankles and wrists. Now there's two main types of people we see that you can kind of lump them into two categories: acute pain and chronic pain. Now, acute pain is something that lasts less than 6 months. Typically, you will heal from acute pain. Say you have a sprained ankle. You sprain that ankle. You end up with a black and blue swollen ankle. Over time, that swelling goes down. The black and blue turns to yellow and eventually will fade away. That is something where if you sprain your ankle, you'll know it. You'll know it right then and there. And then 3-4 weeks later, you might not even know you had a sprained ankle. It might feel completely better. Now, if you have an acute pain and you keep re-injuring, that will eventually turn into chronic pain. And that's why a lot of people will tune into this webinar, as well as a lot of our patients have already started to feel this chronic pain. So chronic pain is something that lasts longer than 6 months. It's difficult to diagnose, and it's pretty universal. About 20% of Americans will deal with chronic pain sometime in their life. So there's typically some type of roadblock that prevents a total recovery or to even get started the healing process. Now, the difference with chronic pain is that this roadblock it can be multiple different things, right? And we just went through the list of them. You know, osteoarthritis, disc degeneration, sciatica, stenosis, joint replacement, post-surgical pain. We're talking about many different roadblocks that will keep you in this chronic pain, and it never seems to get better. Now, the two largest roadblocks that we typically deal with, and that I'm going to hit on pretty hard today in this seminar, is arthritis and scar tissue. We know that osteoarthritis is the most common type of arthritis, and we'll talk a little bit more about that later in the webinar, but these are the two biggest roadblocks. Starting with scar tissue first, there is a way that we heal after we have reached puberty. So when we are young, our body can usually make full recoveries. After we have gone through some time of injury and re-injury and then starting to heal, you start to heal with what's called scar tissue. And scar tissue is like tissue that has more adhesions, it's more bundled up together, it doesn't flex as well, it doesn't have the tensile strength, and it just has very little mobility, has very little blood flow, and it has 10 times the amount of pain fibers. So nerve pain fibers, there's a 10-fold amount that cause even more pain. Scar tissue, I like to say, when my patients come in the door, it's like they want to know, hey, why does my scar tissue hurt so bad? And I always imagine it's like wrapping a Christmas tree in 100 lights, and that's okay, but imagine once you heal with scar tissue, it's like wrapping a Christmas tree with 1,000 lights. It's that much brighter, that's that much more noticeable. And that's why scar tissue hurts even worse. Now, we talked about it in the previous slide, but scar tissue has some recognizable traits. Random crisscrossing patterns, not as flexible, poor circulation, sensitive to pain, weak, and it contracts when you sleep. That's why when you wake up in the morning, everybody is typically doing exercises or stretching. You can't just jump out of bed and get your day going. Now, scar tissue can have many different impacts in the body, and one of those places we see it most often is in joints. Our next slide will talk more about healthy joints. So if you look at this slide, you can see that there's a joint capsule, and it's made of ligaments that kind of encapsulate that joint, just like what it says there. There's glass-like slippery cartilage that covers and protects the ends of your bones. Now, at joints are anything where two bones come together. So there will be a joint in between any two bones that come together. That cartilage is called hyaline cartilage, and hyaline cartilage produces what we call synovial fluid. It fills the capsule created by the ligaments, and it provides a protection, shock absorption, and the movement triggers the production of this synovial fluid. Now, synovial fluid will be made as long as there is hyaline cartilage. That's why you have to keep your joints healthy. Now, as we get into our second roadblock, we're talking more about osteoarthritis. Now, osteoarthritis has some overlying themes. You have lack of synovial fluid, the cartilage wears away and breaks down, the bones will begin to rub together, pain and swelling further the loss of movement, and then the scar tissue built from the injury and re-injury will then calcify and become osteoarthritis. Now, osteoarthritis will then further break down the joint because it's so jagged. So it's kind of this vicious circle in and of itself. Now, here's a slide where I want you to take a look at the difference between a healthy spine and an arthritic spine. You'll get this bone spurring, you'll have narrow disc because, again, that jagged part of the arthritis is going to wear away that disc even faster. So what is the best way to prevent osteoarthritis and to loosen up your scar tissue? It's to move it. To move it or lose it, we like to say. Motion is lotion, is another popular saying. When we choose to move, we build up the amount of synovial fluid that our joints are using, and makes it easier on those joints. It creates a less amount of friction between those two bones that are rubbing together, and it overall produces more of that shock absorption and the protection. Now, you can get moving many different ways. You can go for walks, you can go to the gym and work out. There's yoga, Zumba, there's classes, bike riding. I mean, you name it. But you always have to do what feels best for your body. You want to go into mild to moderate discomfort. That means you're pushing it, but going into moderate to severe pain when you're doing these exercises, that means you're pushing it too far. And it's a balance between extending your limits, but not into a harmful pattern that's creating more injury, okay? Now, my personal favorite is to get in the water, whether that's water aerobics or to swim, any type of swim style that you'd like. Swimming is the best way to take pressure off your joints while also going through full range of motion or limited range of motion, whatever your joints will allow you to do. This is where people come in and where there's this disconnect because they're trying to exercise or they're trying to stretch, but they're not getting anywhere because it hurts too much to do those things. And that's kind of where Midwest Pain Solutions comes in. There's a chronic pain cycle that starts when you can't get that movement into your daily routine. So you have pain, goes into guarded muscles, you have a loss of range of motion, goes into muscle weakness. That muscle weakness overall makes you more sedentary, right? So then you have less energy, you're less active, it goes into stress and frustration, which messes up all the hormones, and then you get even more crankier, and it leads to more pain. So what we want to do here at Midwest Pain Solutions is break the cycle. That includes reducing the pain and restoring proper motion. I talk to my patients and they come in with a laundry list of things that they've tried. So over-the-counter drugs, NSAIDs, non-steroidal anti-inflammatory drugs. They're talking about taking different prescription drugs, anything to get rid of the pain. They do creams and salves. They do patches. They'll do shots, physical therapy, chiropractic, acupuncture, dry needling. You name it, they've been through it. And then on the backside is always surgeries. I see people pre-surgery and post-surgery. Now these next slides I want to go over, hey, why has this not exactly worked for me, or what is it about these types of treatments that have not worked for the people that come into Midwest Pain Solutions? So physical therapy, does it reduce the pain? Yes. Does it restore proper motion? Yes, but a lot of our patients have already come in going through physical therapy. Now, it focuses primarily on muscle movement and can be successful if you get to it fast enough. Now, that's where everybody loses. When you have the pain that keeps on reoccurring and you can't get it to go away with physical therapy. Chiropractic, does it reduce pain? Yep. Does it restore proper motion? It can. Now, this is, again, something that you have to get to fairly early to prevent the chronic side of pain. When I'm here in my office as a chiropractor, I want to also provide people that pain relief without going into chronic pain. So I want to get to the people before they get to chronic pain. That would be the ultimate goal. But because chronic pain has already taken a hold in a lot of our lives, we need to do something extra more than chiropractic. Again, a lot of our patients have already tried chiropractic. It just hasn't been successful because that pain has been embedded for too long. Pain medication. Does it reduce pain? Yes. Does it restore proper motion? No. Temporarily relieves the pain and reduces the swelling. But the dysfunction, the roadblock that caused that swelling, it still exists. And all of that pain that came from all of that dysfunction, it still is there. It's just being masked. Now, the long-term use is often ineffective because you build up a tolerance. And then the second part to that is people have now noticed that you can get addicted to pain medication, and it's led to the opioid crisis. Injections typically will reduce pain, but sometimes they do not. Will they restore proper motion? No. Again, it temporarily relieves the pain and reduces the swelling, but doesn't fix that underlying condition. Now, it becomes less effective with each treatment, and you find that there's more degeneration at the joint that they injected in. That's why you can only have a certain amount of injections throughout the year. A lot of people are at about 3 months. Some of these injections aren't even FDA recommended. Joint replacement. Does it reduce pain? Sometimes yes, sometimes no. Sometimes it restores motion and sometimes it doesn't. Now, joint replacement, you could have a guy clicking his heels, jumping up in the air. He's so happy to have all of his motion and the ability to move back, but that's not the case for everyone. You have some great success stories and some that are not so great. Now, there's always risks with every major surgery, right? And the other back end to surgery is that, yes, right away you might have more range of motion, but you have a longer recovery period. And then second, what's going to happen in a year, 2 years, 3 years time? Is there going to be more scar tissue buildup, which we know happens after a major surgery? Now, there's what is called bone on bone, and that's typically predates why people will get a joint replacement. Now, a joint replacement typically is the result of bone on bone. But in fact, bone on bone has to have characteristics of degeneration, zero cartilage. Now, there's a reality here that I think a lot of people are missing, where they're told that they're bone on bone, but really there still might be a sliver of cartilage left. And that's what we want. We want to keep that cartilage alive, because it's better to have our original material than to have the major surgery and now we're working with replacements. So back surgeries, you have some risks involved with that, and I'll let you read through all of those. What I find interesting is that 80% of back surgeries will fail in 5 to 7 years' time. You always have to weigh it out, what is going to be best for you. Now, surgeries will create more scar tissue and the recovery time is longer, and it's always used as a last resort. Stem cells and regenerative medicine. Does it reduce pain? Yes. Does it restore proper motion? No. And it typically will work initially, but the effects don't last. The long-term results are just not there yet. There's about 2% of cells that will, what we call, differentiate to become new tissues, which means the target tissue that they need to become, only 2% will ever become that cell. Now, that's not high enough yet to be an effective treatment. It will be in the future once they can target that stem cell more effectively and it can actually change into the cells that you need it to change into. But you're not going to grow new joints with stem cells or regenerative medicine. I do think it's interesting and something to keep your eye on for in the distant future. At Midwest Pain Solutions, we got to reduce the pain and restore the proper motion. Here at Midwest Pain Solutions, we're different. We treat the 5 different areas of chronic pain. That includes the different tissues known as muscle, bone, nerve, ligament, and joint, which includes that entire encapsulation where we produce the synovial fluid and we get the shock absorption for our body. When we are treating, we want to treat globally. So we want to hit all 5 of these areas and make sure that they're all working in unison and together so that you can have longer term relief. At Midwest Pain Solutions, everything is FDA cleared. There's no drugs, no needles, no surgery, and it's longer lasting, okay? Here at Midwest Pain Solutions, we do a combination of therapies. These result in decreased pain, increased motion, and to restore your life and patient's life to the way that they want to be, the way they were before the chronic pain. So what does that mean? What do we do here? What we specialize in is high intensity laser therapy. Again, this is FDA cleared, it's drug free, it's non-invasive, and it's safe. So everybody asks, hey, does it hurt when you come in here? No, it does not hurt. It does not hurt at all. Because it is light that is penetrating down deep, there is no known side effects and there's no pain associated with that. How does the laser work? We're often told that it is similar to how plants get their energy from the sun, which is photosynthesis. Now, laser light is not the same as energy for the body, but it is an energy that tells the body to heal itself, okay? The laser will restore normal function through biomechanical processes within the cells of muscle, bone, tendon, ligament, nerve, and throughout the cartilage within the joints. How it does this is it strengthens the connection between the DNA and the RNA. I like to explain how the laser works as the DNA being the blueprint and the RNA being the foreman. Now the DNA is long and expansive. It has all of the mapping out for our entire body. Now the RNA will go in and get the message from the DNA, and it will spread it around to the rest of the organelles within the cell. Now, the second part that the laser works on is in the mitochondria. It will stimulate the enzyme on the outside of the mitochondria, and it will produce more ATP, adenosine triphosphate, which is what we use for energy in our body and energy transfer, which allows our body to go through its normal daily motions. They call that metabolism. The laser will restore that cell to a more normal, healthy function. And I will get into this full and complete in another video, as well as in person with you when you sign up for a no-cost consultation. Now, the benefits of laser can be vast. It will soften scar tissue, relieves pain, it reduces swelling, it improves blood flow. It also improves nerve function, speeds cell repair and growth, and it resets the chronic pain cycle. So when we have chronic pain, the reason that it's so much different from acute pain is it is a path that's worn into our pain fibers, into our nerve pain fibers. So it's like, I always explain to my patients, it's like a game trail through the woods. When certain deer or bear or coyotes, whatever, they're walking through the same path over and over, and you can see where that path is. The same thing happens when we have chronic pain day after day, week after week, month after month, and then eventually year after year we have the same pain, and it creates this constant chronic pain cycle. They call that the chronic pain reflex. Now what you want to do with the laser is to erase that chronic pain and the chronic pain reflex. I got into this a little earlier, but does it hurt? The therapeutic laser does not hurt. There's a difference between therapeutic laser and surgical laser. Therapeutic laser and surgical laser, they work on the same premise. Therapeutic laser will deliver energy to a cell that it can then use to heal itself. A surgical laser is a therapeutic laser that is just narrowed down, very small beam, and it produces too much energy for that cell, and they call that cauterization. So it literally overloads the cell and it cauterizes that cell, and that cell dies. Now in therapeutic laser, it's much different. It's a broad light that penetrates deep into the body and produces light for the exchange of energy within those cells all the way down to the joint and to the areas that you need it most, the nerve and the cartilage, the muscle, the bone, and the ligament. So it's warm and it's soothing. Is it safe? Yep, FDA cleared. It's been used since the 1970s, and there's no known side effects. Is it effective? Yes. Simple and plain, it is effective. There's plenty of studies out there. You can go in any medical journal, on Google Scholar, you can go anywhere and find many different studies that talk about the efficacy of high intensity laser or low intensity laser and its effect on pain. Not all lasers are created equal. So even though it seems that there's laser on every street corner these days, they're not all the same laser. It's like talking about the difference between a Toyota Prius and a Formula One car for racing. There is low-level lasers and high-intensity lasers. We run high-intensity lasers. In fact, we have the highest powered lasers on either side of the Mississippi. That's all thanks to Dr. Kurt, who produces them in-state here in Mosinee for Crystal Med Tech. The Class 4 laser is anything over half a watt. Now, that is by definition, by the government, the most powerful laser on the market. We run 60 watt and 500 watt high intensity lasers. So you can just tell how advanced those are compared to what the standing is nationally. We develop and build our own lasers. So again, it's made in Crystal MedTech in Mosinee. It's the deepest penetrating laser available, and we hold a patent on how the light is delivered to the cell, and the laser will go deeper to the root cause of that pain. Protocols are developed and tested on professional athletes, professional football players, professional baseball players, as well as Olympians training for the Olympics. Here at Midwest Pain Solutions, we're more than just laser therapy. We have a combination of therapies that make us successful. So even though we're known for our high-intensity laser therapy and that our high-intensity lasers are unique to only us and what set us apart from everybody else, we also use a combination of things that help make the treatment successful. This includes chiropractic, extracorporeal shockwave, high-intensity laser therapy, Theragun and hyperice, hydromassage, and distraction. These are the most advanced technologies. They're not found on every street corner. They help us to provide treatment that is different for everyone because everyone is different. That means people come in with many different problems. Aside from the different joints that can be hampering their lifestyle, anywhere in the spine, again, the hips, the knees, the ankles, wrists, elbows, we treat it all because everyone can benefit from getting those joints healthier, restoring proper motion, and returning them to a better life. The therapies will change as you progress because we'll need to add things in and take some things out that are more or less effective for you. But it all is pointed back to breaking the chronic pain cycle, reducing the pain, and restoring the proper motion. When we go back over what we talked about today, it's why you're in pain, why the other therapies haven't worked, and what made us different. I hope you learned a lot in this webinar, and I just want you to know that there's a better life out there, there's a better life waiting for you, and that you can really find some pain relief while also still doing the things that you want to do. I think that's important because it's not like it's a long recovery period. You recover as you go through treatment. So it's slowly, surely building progress so that you can get better. There's 3 easy steps to the pain relief. There's a no cost, no risk consultation. That's what we do with everyone to get to know you better. So instead of me sitting up here and talking all the time about the webinar or the laser, talking about what we do, we want to know, hey, what has gotten you to this point in life and how can we put our knowledge to making that better? So we do a no-cost consultation. We have affordable exam and x-rays. So it's $50 for the exam, $50 for the x-rays, and then we do a personalized care plan. Who are some of the people that have benefited from the treatment here at Midwest Pain Solutions?
I think Midwest Pain Solutions works for the simple reason of they don't keep targeting the worst, the bad spot, like say it's your back or your shoulder. There's actually other parts of your body that contribute to the pain, so it's multiple things that I believe get the results you're looking for.
Midwest Pain Solutions gave me the ability to walk again. It gave me the ability to stand, to cook. I was able to go out and see my new grandbaby. If I wouldn't have been coming here, that would not have happened because it was just too painful. And I mean painful. There were days when I was in tears. It hurt so bad. So Midwest Pain Solutions helped me get back into a normal routine of cooking, baking, cleaning my house, so forth and so on, and I'm so grateful.
After I completed the treatment program, I was able to go to the grocery store. I was able to get in and out of my car without pain. Before that, I really could only access my driver's side car. The passenger side, I couldn't lift my leg high enough without pain to get in and out. So that was a big difference, being able to, at least go to the grocery store, walk around the store, and get back into the house without pain. It was just amazing, the difference after the treatment.
This has been such a great alternative to having surgery. I think one of the things I said to Dr. Jackson was, my gosh, after so many years of so much pain, I can't believe how quickly things turned around. So if you're even possibly considering surgery, I would give this a try before you have to go through that and all the rehabilitation and stuff afterwards. So
I waited 32 years to get to those 3 months worth of effectiveness. And I was really amazed. I almost take it for granted now after treatments because I feel that good. I have to remember that I actually felt that bad. I just feel like my whole reason I was here is completely gone. I am 100%.
I like that the stuff was non-invasive and it was alternative and it was successful. It's FDA approved. You know, it's successful.
Dr. Jackson with Midwest Pain Solutions has fixed my knee, my shoulder, even my neck. It's more than a chiropractor. It is the laser that takes care of most everything.
Sit down and see what they can do for you. They're more than willing to do that, and it's costs you nothing to come in the door. And you may find that, like myself, it turned out to be the best door you ever walked through.
All right, guys, I wanted to thank you for watching this webinar. I really hope you learned something today, and that if you really are in a lot of pain, give us a call. There's always something that can be done, and if we're the place to do it, I'll let you know right away. So no BS. We'll cut right through the crap. We'll just tell you straight up, hey, if we can help you, I'll tell you. And if we can't help you, I'll let you know that too.